Good morning, everyone. Thank you so much for your time. Thank you so much for your time that you have allocated to gain the knowledge. And this webinar is sponsored by Ashish Life Science. And Ashish Life Science, as you are aware, that always try to enrich our customer. So that's why we are here to enrich, whether with the product knowledge as well as the technical aspect of all the disease conditions. So I'm very pleased to have all of you on the same platform, and you have allocated your time for this webinar. And as we all are aware that Ashish Life Science is exclusively dedicated for animal health company, having its own manufacturing unit as well as in R&D in India. And most of our brands already there, and Ashish Life Science is always trying to serve better for farmers, for veterinarians, as well as the academic people. So, with this note, I would like to introduce one of my guru. Uh, he's obviously he's a man who doesn't require any, introduction. And if I'm introducing him, it is my honor that I'm introducing him. Certainly, he's a very well-known personality in India as well as in the academic profile of Indian universities. So none other than Dr. SU Digraskar. And obviously, you can read on the slide that he was ex-dean in Shirwal Veterinary College, also ex-professor and university head for the Department of Epidemiology and Preventive Medicine. See, this is just a brief introduction of Sir, but the story doesn't end here because it's, his plethora of the work continues for a long time. Like till now, Sir has obviously for his BVSC and MVSC, he had his back the gold medal with the first rank. Evenly, Sir has PhD from the Andhra University, from the Hyderabad University of Tirupati. For his awards and distinctions, so Sir has received the Indian Council of Agriculture Research Junior Fellowship Award. Evenly, he is university ranked. This I told you. He has backed Dr. S. Swaminathan Iyer Memorable Award. Evenly, he has attended many of the international conferences. He was a chairperson for many of the conferences, and this was not only the end for his beautification of his career, but he also has yoga shikshan counselor. So he has successfully passed that exam, and he delivered many lectures for the yoga for various universities, evenly for the field people, evenly for the regular people also. And obviously, he goes for the various colleges for this yoga presentations. He also has backed the Best Veterinary Academician Award in 2017. Also, he got various awards for the poster presentation, oral presentations in various conferences. Obviously, he is a lifetime member for Indian Society for Veterinary Medicine, Indian Veterinary Association, Indian Science Congress Associations, and lot many are there. And he has also, took active part in Mantra Diksha in yoga school. Also, he's a lifetime member for the advancement of canine practice. As far as his teaching career is concerned, he has still graduated more than 100 students as advisory committee member, as a direct guide, and as a co-guide also. He has actively participated in badminton, evenly the national gatherings, that the national camps, animal healthcare camps, deworming camps. So this was a bit about Sir. Also, he has many research published articles, more than 165 abstracts he has on his name. Evenly the lead papers, he has more than 10. His research papers are also 75 in national as well as in international magazines. Also, he always keep himself engaged in radio talk show, television shows, the technical publication, popular articles writing and all. Also in a book, he has the book name is Deshi Govansh. So that means the indigenous breed. So he has written one chapter on that. Also, he had various vaccination camps, even in the diagnostic units, intensive care unit. So that everything he started in our college also. And obviously, he's a good counselor and always strive for giving his knowledge or sharing his knowledge to the veterinary world. So I'm very glad to introduce my guru, my sir. So, sir, over to you, sir.
Thank you. Actually, Doctor, I'm very much overall. My student and my fellow veterinarians, brothers and sisters is actually my real wealth. I'm an academician and will be happy to share my knowledge about the topic allotted today's. Now, the today's topic, as you know, that it is the management of PPR in sheep and goats. Now, what is this management of PPR? Now, dear friends, see, unless we are very well versed with what is that PPR, what are the various aspects of PPR, how it causes the disease, what are the factors involved in it, unless we know the various aspects, we cannot achieve success in the management of PPR. And say basic things. See, unless we know the physiology, we cannot understand the pathology. We have to correct the pathology. Now, when we want to correct the pathology, definitely we must be very well versed and we should be sound in the basics. And let us go one by one, say about the basics of this disease, and then we will have a discussion about the management of PPR. I hope that you are all are audible and everybody is comfortable.
Yes,
now,
sir, very much audible, sir.
Okay, thanks. Now, what is this title PPR? Say this is a different, unusual, atypical title. PPR says n number of diseases my veterinarians they know, but what is this Pestidis, petites, ruminants, a zigzag name? See, this is a French title, and actually, if we bifurcate and let us understand the basics, see, PASTI, it stands for disastrous disease or a deadly disease, or a more profound, a more precise name or more precise meaning will be a plague. So you know the plague, and then des means of, the meaning is of, and the petites, its meaning is small. So it is a, and ruminants means ruminants. So it is a plague of small ruminants. It is a disastrous disease of a small ruminants, and this name Pestidis petites ruminants, because it is a zigzag and uncomplicated. All the scientists have coined its name as, and is popularly known name as a, its acronym as a PPR. Acronym you can understand. Say it stands, PPR stands for Pestidis, petites, and ruminants. Now, the other names are goat plague, ovine rinderpest, pseudo rinderpest. Now, because these disease symptoms are very similar to that of a rinderpest, this is also called as a, previously it was confused whether it is a PPR or whether it is a cattle rinderpest only. Now, you see, in the last century, it has been very much clear and they are separate. But, and as you know that what is the history of rinderpest? Rinderpest was a devastating epizootic disease and actually an instrumental for the having a veterinary profession. First veterinary school was established in 1762. It is only because of the epidemic of the rinderpest. So similar extent to that, this is a more dangerous disease. Now, because in this disease, the classical manifestations are stomatitis, pneumonia, enteritis, that is enteritis and pneumonia, and therefore this is also called as a stomatitis pneumonia enteritis syndrome. Or some authors also prefer, because of this prominent nature, as a pneumoenteritis complex also. Okay. The other name for this disease is also kata. Actually, kata, meaning of kata is that those diseases in which there is a catarrh, where there are more of the secretions. And because in this disease, there are secretions from the nose, there are secretions from the eyes, like, and initially which were serious, but they are soon becomes an infective because of this viremia or mucopurulent continuous discharges, and therefore the other name is kata. And some authors do designate this as a small ruminant plague. So these are the various synonyms, but the entire all the synonyms, they are just designated only to for PPR, a deadly dangerous disease of the sheep and goat. Now, what is actually the extent of a importance? What is this importance of this disease? Why we are very much afraid of this disease, and why this OIE or Indian at an international level, so much funds are being given for this disease? See, because as I have told you that it's a devastating epizootic disease, and the small ruminant population of, as on today, definitely more than 70 countries of, see, the major continent which is being, say, at risk is the Africa, Middle East, Asia, Indian subcontinents. And on 24th of June 2022, Bulgaria government has to declare that in Europe, PPR has already started. Say it has come from Egypt, say from this uppermost part of the world, say the northern part, and from this Turkey country, it has entered, and all those things. We are not bothered about it. But the now as on today, as on 2023, the disease has already entered in the Europe continent. That means those continents which were free, they are also being affected with the PPR. Now, whatever the sheep and goat population is there, more than 80% of the population is at risk of this disease, and an estimated loss is more than $2 billion per year. A world economics, because affecting this because of PPR. Now this OIE, or what is called, what nowadays what we suffer, what they call it as a World Health Organization for animals. This OIE has enlisted this disease not only notifiable. It is not only a notifiable. That means we only should not report this disease, but it has given a place as a priority of this disease. Say this is being enlisted as a notifiable and priority disease. Priority disease in the sense that in 2013, FAO, OIE, all these world international organizations have decided this because of the economic loss and severity of this disease. They have given a target of eradication of this disease on a similar line of rinderpest by the end of 2030. And therefore, they have categorized this disease in addition to the notifiable as a priority disease. And therefore, these are the two things with this disease. And of course, in India, if we go that what is the loss per year is more than 8,000 million per year. And to an human population, see, whatever the entire human population is there, the poor farmers, they are mainly, say, engaged, they are mainly involved in the goat and sheep husbandry. And see, the population which is being suffered because of this human population which is being suffered and affected economically because of this PPR amounts to 72.9% of the world population. So that much, say, population or human population is there. And we know that if we go for the history, that in Ethiopia, because of the interpaste and all that, they say there were, say, heavy losses because of in human beings and all that, because of these famine conditions and so many of these. And say, we know the history knows that what has happened to a human, say, mankind because of the interpaste. So similar things should not repeat in African continent or in a particular country or in any other country. See, World Organization, World Health OIE has taken a serious note of this disease. Now, Kenya's ILRI, International Livestock Research Institute, has already identified this disease as a priority animal disease and whose control is considered or is signified for the poverty elevation. And therefore, they have they have realized that what is the importance of this, and therefore, for poverty elevation, it must be controlled. That is their main target, and they are going to achieve it. I hope with all of our involvement and with all cooperation of all of us, we will be able to do it by 2030. Now, as far as the Africa is concerned, see, almost Africa continent is having almost 40% of the entire world's gold population, where the 72% of the poor people are there, and they are contributing to the economy, and they are being affected to a greater extent because of this PPR. And say all these figures are there. And see, livelihood of, as far as the world is concerned, livelihood of 75 crore people are being affected because of this disease. So with this disease, say, one must now get the alert. One must become an alert that we should not have any, we should not keep any lacuna for control of this disease or for the management of this disease. Now, for the last 20 years, I have taken a figure that now the global distribution of 2007 to 2015 is there, which has been marked in the red color. Now, and from the 15 to next 2017, if you see that, we are able to see that the Europe has been entered as a PPR affected continent. And no country has been, say, no, there is no deletion, but there are additions in the countries. And therefore, say, this disease is having a highest significance as far as its contagious nature is concerned, as far as its economical impact is concerned, and therefore veterinarians and stockholders, all say goat keepers, stockholders and all that, they must be serious of this disease. Now, let us go scientifically that one by one aspect of this PPR. Now, I hope you have understood what is the significance of PPR. Now, by definition, PPR or small ruminant plague is an acute or peracute. In many cases, it is also peracute also. Say in the last decade, say from 2006 to 2018 and all that, there were many outbreaks, and where we have witnessed the peracuteness of this disease. Though, of course, I must admit, we all must admit that, say, in these years, it is getting improved, but the one side, we say that it is getting improved, but the other side, we see that it is being, the number of countries being involved with the PPR, they are increasing. So one must be sure. So it is a disease of acute or peracute nature. It is a highly contagious. Okay, then it's a notifiable. Just as I have told you that it is economically important and transboundary. Transboundary means across the say boundary of across the country boundary. Say from say a particular disease previously, suppose for example, the Tanzania is free from PPR, it's not there, and the Zimbabwe is Zambia is positive, say Zambia is having PPR, and if the disease has transmitted from Zambia to Tanzania, say it is a transboundary. So say it has been transported from one country to other country, and therefore it's called as a transboundary diseases of a sheep and goat associated with high morbidity and high mortality. Because of this nature, there is a high morbidity and mortality is also very high, and therefore this disease is an important viral disease of a sheep and goat. Clinically, this disease is characterized by high fever, conjunctivitis, oculonasal discharges, necrotizing and erosive stomatitis, gastroenteritis, diarrhea, bronchopneumonia, and followed by death or animal recovery. In majority of the cases, death do occur, or if it is attended in early stages, say they recover. And the endemic states or endemic continents are Africa, Arabian Peninsula, Middle East, Central and South Asia, and as I've told you that Europe also. Okay. Now, what is the etiology? Etiology, as we know, the PPRV virus, now it has been named in 2020, last year only. Of course, its revision is to be taken, but last year only OI has published that it's renamed as a small ruminant morbillivirus. This belongs to genus Morbillivirus, family Paramyxoviridae, and is closely related to a cattle rinderpest virus, measles virus of a human being, canine distemper virus of canines, and phocine, that is the seals distemper virus. Now, the small ruminant morbillivirus is an enveloped, non-segmented, negative stranded RNA with there are two non-structural proteins which are V and C. It is having a total, say, 8 proteins. 6 are structural proteins, surface proteins, glycoproteins. One, say, of which their fusion protein is F. Another is H is a hemagglutinin protein. Matrix is a M protein. Nucleoprotein is N. Phosphoprotein is P. And say our inside say large protein is L. Of these, this H glycoprotein and F glycoprotein, which are present on the outer surface, they are responsible for attachment and penetration into the cell. Now, only best things for a veterinarian or good thing for veterinarians is that there is only one serotype. But even if there is only one serotype, there are 4 genetically different lineages based on the genomic sequence of this F and N gene. Now, what is this? Say this is the schematic representation of a small ruminant morbillivirus, and this here the F fusion proteins, H proteins, and all the 6 proteins and how they attach and all that, they have been shown very clearly. Now, these are the lineage distribution, worldwide lineage distributions. Now here, it is very clear that this western part of Africa, that is see Ivory Coast and all those where the lineage 1 is more prominent, 1, and this eastern part, say Western Africa, lineage 1 and 2 is a predominant lineage, PPRV virus, whereas this eastern part is lineage 3, whereas in case of the rest of the part, including the Indian subcontinent, Asia, the lineage 4 is the predominating lineage of a PPRV virus. So, though the PPR virus is prevalent in all these 70 or 72 countries, but what is that lineage? What particular strain is more prominent? That is this picture. All this says that this is an initial features, but because of its transboundary nature. Now, say for example, you are able to see that the lineage 4 is prominent only in India or Asian continent. Okay, but now later on it has entered the Africa also. So it is not like that. This is a rough distribution, and because of the transboundary natures, those countries or those areas where a particular lineage was not prevalent, now it is being seen. So I think you can understand that the lineages, they are being, say, transferred. Their placement is being transferred from one country to other country and is being variable. Now, say what has happened, say previously there and it has been also postulated present also that lineage 1 and 2, they are responsible for per acute form, whereas lineage 4 is having, say, acute form. So this was the nature. But see, pathogenicity and the pattern of disease, it differs. It differs from year to year, and say we cannot we cannot be a very strongly say that the lineage 1 will be always highly pathogenic. That we cannot say. But as a basic veterinarians, one must be well aware that lineage 1, say where in the areas where the lineage 1 is there, one must be more cautious. This much lesson we can take from this. Now, what are, say, how the disease occurs? What are the various in which animal it occurs and all that? So that comes in epidermal. Now, as you all know that this disease is discovered first in 1942, and that is in the western side of Africa, that is Ivory Coast or Cote d'Ivoire. And then subsequently it has spread into nearby countries towards the, say, of the Western Africa, and then say the rest of the world and all that. And now we see that almost 72 countries are being affected. Now, what are the hosts? The primary hosts are sheep and goat. Actually, this virus, primary, say, sheep and goats are actually both are actually equally susceptible. Virus affects to both the host. Both the animals, sheep and goats, are equally susceptible, but the goat exhibit more severe clinical form, and therefore the severity of this PPR is always more in the goats as compared to the sheep. Now, morbidity in exotic area is 50 to 90%, and particularly in the outbreaks and so. And the case fatality as far as the goat is concerned is always more as compared to the sheep. It is in the goat, and particularly in the kids, the case fatality rate can be 60 to 90% or can be a 60 to 100% also. This is my personal experience. Because sometimes if once in your goat farm, if once PPR enters, and just if you have lost some initial 4 or 5 days, the entire goat farm will be vanished. And therefore, one must be very alert and cautious regarding particularly, and all the steps must be initiated in the early phase of the disease on. Now, those goats, see, young goats, particularly 4 months to 1 year age, is the most vulnerable period for PPR. Of course, the virus doesn't affect only sheep and goat. It do affects the other animal, domesticated animals, particularly as far as the bovines and porcines are concerned. You see, cattle, buffalo, pigs, they are equally, they can be affected. They show the subclinical symptoms. But for a veterinarian, again, another good thing is that all these are the dead end hosts. So what is meant by dead end hosts? Dead end host means where the virus stops. That means they do not exhibit symptoms, they do not transmit symptoms, and say there is no carrier state at all. There are no vectors, there are no reservoir hosts. So this is the good thing, that to a particular, say, it is affecting a small ruminants only. There are reports that the PPR has affected in Kenya. These camels were affected. There were outbreaks of a PPR in Sudan and nearby areas. Now, say this is a map which shows that the small wild ruminants to a number of about 36 species, 34 to 36 species of wild ruminants, including say some wild animals, they may be affected because of the PPR. So animal wise, say animal species wise distribution of PPR in different countries, right from 2002 to 2019 has been shown in this map. And you will find that the Asian continent, Middle East, and the Africa, particularly the eastern side, eastern countries, including some Western countries also of a Africa continent, they are being affected with this disease. Now, let us understand the most important thing, that how this is being transmitted from one goat to other goat. See, transmission is mainly by aerosol droplets, and those goats which are in contact with the affected goat, you will say these droplets are inhaled and they become affected. Large amount of virus is present in the exhaled air. All body secretions and excretions. That means lacrimation, nasal discharge, saliva, feces, urine, all these are rich in PPRV virus. Of course, the feces, their number is high, and therefore they contaminate the entire shade, water, say some building, fomites, the human beings, the labor workers which are working in the goat shade and all that. So because of these direct feces, it contaminates the area of a shade. Then infected goats shade virus. Once any goat which is suffering, yeah.
Sir, right. मेंढी बद्दल जास्ती बोला.
Pardon?
मेंढी बद्दल जास्ती बोला.
Mendi. Okay. Now, this sheep, in sheep also the similar symptoms are there, similar form as far as the goat is concerned and as far as the sheep is concerned. The nature of the disease PPR in sheep is same. Only the thing is that the mortality in case of sheep is less as compared to the goats. Now, in the sheep also, the route of transmission is aerosols, close contact between the different sheep. The lambs are more vulnerable, and all secretions and excretions excrete the PPRV once they are affected. And once the direct feces are there, now this direct feces may contain PPRV of affected sheep to an extent of up to 1 month, or in some cases, there are certain references that the affected sheep and goat excrete the PPRV virus up to the 2 months. Now, if you consider what is the period most vulnerable, most infective period, that initial first week, in the first week of affected sheep and goat will excrete maximum number of viruses, and later on their number will increase, but the feces will be containing large number of a PPRV virus in their feces, and therefore the affected sheep and goat is to be taken care of up to 1 month as a control measure, that they should not transmit the disease to the other shade healthy sheep and goats. Now, what are the predisposing factors for this disease? Predisposing factors are change in weather. Say, sometimes there will be heavy cold, sometimes there will be heavy rain, sometimes heavy dry season, or there will be onset of a rainy season. And the most important thing in case of a sheep and goat, because of which this disease immediately gets transmitted and its contagious nature is exhibited is because of the overcrowding. See, all those things are academic and I can understand and I admit that, see, practically these things are little bit different, they are difficult, but at the same time, when we know that what are the impact of this disease, what are the demerits of this disease, what are the economic losses of this disease, one has to be very cautious and one must go on a scientific way on. Say the estimated or the recommended area for one goat or for one sheep is 1 square meter. We do not keep that much, but we keep we are we are neglecting the overcrowding and we are overcrowding the sheep and goat to such an extent that say not only PPR but other diseases, they also being transmitted from one sheep to other sheep and all that. And therefore these predisposing factors must be taken in care of if we want that the disease should not be transmitted and your health, your stock, your flock should remain unhealthy. Now, if there is a history of a recent movement, say there is some migratory goats or transported goats from one place to other place, say the disease is transmitted. So with the introduction of a newly purchased animal, we do not know that newly purchased animal, immediately if it is being mixed with your healthy stock, we do not know. And this introduction of a newly purchased animal or contact with the trade animals, an animal which you have purchased or you have taken your healthy animal to a market, say for trading, and because it was not sold again, you took it back. But in the market, you do not know your sheep has come in contact with what healthy sheep or PPR affected sheep or any sheep which is in incubation period. So those nomadic sheep, those affected sheep or goats in the trade market, or those which you have come in contact, if unknown sheep and goat, your healthy stock can pick up infections. Now, for any disease, what are the important factors which are responsible for occurrence? So these factors are called as a disease determinants. Say for anything, this is a general epidemiology theory. For occurrence of any disease, the accepted theory is a triad theory. Tri means three. Ad means there are three agents. So what are the three agents? The first is a host. Okay. The second one, say first is a causative agent. The second one is the host. Maybe animal, maybe human being. Okay. Maybe plant or anything. Say one is. And the third one is where all those things are present, that is the environment. So a causative agent, bacteria, viruses, and all that. So ours is the PPR virus. Host is a small ruminants and the environment. Now, when these three factors, they overlap each other, they come to each other, they overlap each other, that is called as a triad overlapping. And overlapping of the more is the overlapping area, a significant overlapping area of an causative agent, host, and environment, occurrence of a disease is sure. If these three areas are separate, disease do not occur, outbreak do not occur. Outbreak, all of a sudden outbreak do not occur. Outbreak will occur when all these three agents, they overlap and form a significant zone of occurrence of disease. Unless a significant zone of occurrence of disease is occur, the outbreak do not occur. So this is a epidemiological model, but at least you must know that what are the factors, and that's why I'm presenting here. Now, agent is a PPRV virus. What are the environmental factors? Is the stress, stocking density, nomadism, and the introduction of a new animal. Whereas in the environment, say in the host, the factors involved of the host are age, breed, immune status. If the immune status of your sheep is affected, say naturally you will be at risk, and presence of intercurrent infection. So what are the if any other infection is there, say you are likely your animal becomes more vulnerable to pick up a new infection. Then the next scientific way one must know is how the disease occurs. But now, when this virus enters, as I have told you that the major mode of transmission is inhalation. The other indirect way is through the other contacts, contaminations of that is, and contamination of a feed, water, and all that. That is a indirect way. But the direct way is inhalation. Now, once the virus enters to the respiratory passage, it replicates first in the tonsillar tissue, retropharyngeal lymph nodes. And then after that, it enters where the primary viremia will occur, and then immediately after once it has established, okay, once it will enter, and then it will see that no, this is a good place for me, because every virus requires a live cell. Then it will go and it will proliferate the lymphoid tissues. Say maybe pair patches, maybe a spleen, okay, or say respiratory tract, and then afterwards they will enter the circulations where they will produce a viremia. So this is another good presentations, where in the initial stage, in the first figure, you will see that say it is through inhalation PPRV has entered in the dendritic cells, macrophages. These are all the immune cells. Dendritic cells, it doesn't mean that it has something to do with the brain. Usually we people, because we know that the nervous system and all this terminology, dendritic cells has nothing to do with the brain. They are the immune cells. Here they will multiply, and from these, say they will go either to the pairs patches of the intestine, where they will produce a intestinal form. If they will enter the spleen, the splenomegaly, and the lymphoid tissue, where they will immune system will be affected. So, and this respiratory system will be affected, because they enters the respiration, and the first primary viremia, it occurs in the immune cells. So these three target organs, that is the elementary system, pulmonary system, and the immune system. These are the three systems which are being affected because of this PPRV virus. And according to its involvement, all the symptoms, clinical symptoms, are being exhibited by this affected sheep and goat. Now, the clinical pictures, as I've told you, that this is a peracute form, acute form, and subacute form. All these sheep and goats, they can suffer with any of the three forms. Nobody should be under impression that no, my sheep is very well protected and it will not suffer, because the literature says that it's a disease where only subacute form is there. It's not like that. Then with the change in the pattern of the disease, the manifestations are different. Now, these are the general things which I have mentioned, that in the peracute form, say of course, for the PPR, the incubation period itself is a very less. Incubation period doesn't last for more than 6 days or 1 week, usually. Okay, in majority of the cases, but it may vary also. But on an average, say 2 to 6 days or 2 to 7 days, you can take it. In the peracute cases, they death occur within 2 days. Not much more symptoms. There's a hypothermia, where they have very high temperature, prostration, piloerections, discharges from the nose and eyes, respiratory distress, dyspnea, and death. So these are the symptoms, and similar symptoms will be seen in the acute form. There will be high temperature, pyrexia, nasal discharge, serous discharge from the, there is a serous, initial serous discharge from the nose, there will be heavy lacrimation, and later on in the, after 2 days of this fever, you will find that the oral lesions, now these oral lesions, that is a erosive and necrotic lesions, these are the peculiar cardinal manifestation of a PPR. If you see any sheep with these lesions, immediately you can predict that this is a case of a PPR only. These erosive lesions are present in the, on the first lower lips, then inside the gums, inside the, just below the incisor teeth, or an area of the gum which is between the lower lips and the incisor. So all this area is being affected with the erosive lesions. Now, dorsum of the tongue, ventral aspect of the tongue, these erosive lesions in the buccal cavity, in the oral cavity, they also are extended to the palate, pharynx, and they may affect the, they may reach up to the abomasums. It's not like that. But a peculiar bran-like discrete lesions, initially say these are the lesions, then they coalesce and they form a pseudomembrane. And if when you see the affected sheep or when you see the affected goat, you find that some whitish deposits over the tongue, which is having a very fetid odor. And that is what we designate as a halitosis. Halitosis, fetid odor, bran-like deposits, these are the cardinal signs of a PPR in sheep and goat. High temperature, nasal discharges, or there are these discharges, they dry up, they form an exudate. Say this exudate, it get dry up and it forms a crust either over the, in the medial canthus of the eye or over the nostrils, or over the lips. So these crusts are also being formed. So that indicates that there was a nasal, there was a infective discharge from the nose and from the eyes. Then the diarrhea, it develops the next phase. This diarrhea is always fetid and say there it contains mucus, sometimes blood. And no soon this simultaneously with the affection of this alimentary tract, similarly the lungs, both the lungs, they are involved. Just generally these apiculus, immediately they get involved, and the animal develops, in majority of the cases, the animal develops a bronchopneumonia. See, Pasteurella, all these organisms, usually they are present in the upper respiratory tract. But when the immune status is depleted, they becomes a upper hand, and usually the secondary bacterial say infection of a lungs, of a pulmonary, of the lungs or pulmonary system is a usual phenomenon associated with the PPR infection. And this produces anoxic and anoxia. The animal is unable to have sufficient oxygen because of the consolidation of the lungs, because of the edema of the lung, consolidation of the lungs. The lungs, the alveolar tissue has have consolidated, and therefore they are unable to transport oxygen to an sheep and goat, and they die of a anoxic anoxia. So this is a picture of a acute form of a PPR. Now, abortions can occur in all the three: subacute, acute, peracute, acute, or subacute. But the abortion usually it occurs in the advanced pregnancy. In subacute form, the signs are similar. Incubation period, it extends up to 10 days. The signs are a little bit milder, and the death may occur not immediately, but can occur up to 15 days also. Now, this is the general things, but now if you see, there are certain literature, you will find that in the Kenya, or other countries, say nearby countries of Africa, the PPR affected goats have shown a symptoms of a edema at the periorbital area. So near the eye, there were edema on the face because of the PPR. There are, say, throat edema, periorbital edema, or nodules over the body, nodules all over the body. These are the observations of a clinical observations of in Kenya because of the affected PPR sheep and goats. Then these nodules, they are also found in the genital organs also with the PPR affected. So of course, there are certain alterations, there are certain deviations from the clinical findings in the different countries, but overall picture I have shown you. Now, I say these are the photographs of the affected, goat and sheep. Say 5 specific cardinal signs. What are the 5 cardinal signs of PPR? Say pyrexia, oculonasal discharge, oral lesions. I have told you that, see, erosive and necrotizing stomatitis is a cardinal sign. Diarrhea. So these are the symptoms, or the clinical picture. So these are the photos where in the first photo, the animal is showing emaciation, pyrexia, where the nasal discharge. Initially, it is a serious in nature, watery in nature, but soon it becomes infective, and the infective nature is diagnosed by the color of the nasal discharge, which is the yellowish thick color. Now, this stomatitis, brown-like deposits have been depicted in the third picture, and this dyspnea has been depicted in the fourth picture, and is heavily soiled hindquarters has been depicted in the last picture. So these are the 5 cardinal signs by which you can say that no, my sheep or my goat is, I need not go for any laboratory investigations. It is very clear that my sheep is or my goat is affecting with the PPR only, and I must be I should take an immediate action on it. Now, what are the different clinico-pathological changes? Now, as far as the clinico-pathological changes, you find that, say, if you see what is the blood picture of a affected sheep or goat, if you analyze the blood picture, you will see that there is a severe lymphopenia, leukopenia. And as I have told you, that's because this virus, it attacks the lymphoid systems, it multiplies in the lymph nodes, it gets involved, it infects the lymph nodes only. So naturally, these leukopenia and lymphopenia, this is the most significant findings all over the world. These are the consistent clinico-pathological alterations in the blood of the affected sheep and goat. Because of the diarrhea, there is a hemoconcentration. To the extent, say, if there is a more diarrhea, there will be more hemoconcentration. And say, once there is hemoconcentration has exceeded some 10% or 12% than the normal value, you know that the death is sure. Say, and therefore you should see that your affected sheep or your affected goat must not enter into a 10% dehydration state. Okay. Then there is increase in the total, because of the hemoconcentration, you will find that the PCV is increased, but there is a decrease in the total erythrocyte count, and there is a thrombocytopenia. This in the typographically, there is this decreased word typing has been remained, but you can make it sure that there is a decrease in the TEC count and there is a decrease in the platelet count. Now, this virus do affect the hepatic functions, which is manifested by increasing the liver enzymes, and there is a hemoconcentration. It do target the kidney going, and therefore it is manifested by increase of the BUN and creatinine. There is a hypoglycemia, hyponatremia, and hypokalemia is because of the diarrhea. Now, what are the necropsy findings? So necropsy findings, you will find that the carcass is dehydrated, it is the hindquarters is soiled, there are crust and exudates over the eyes, nose, lips, the erosive lesions. Just now I told you that erosive lesions, bran-like deposits, pseudomembrane over the tongue, pharynx, esophagus, and extending to the abomasum. And this particularly similar to that of a rinderpest, these intestinal folds, large intestinal folds, say in the colon and rectum, they become hemorrhagic. Hemorrhagic ulcerations are masked in the ileocecal region, the colon and rectum, and these typical hemorrhages, they give them an appearance like a zebra strips or zebra markings. Regional lymph nodes are always swollen. Particularly this nasal passages, you will find that these lymph node is highly swollen. Now, regional lymph nodes, they are enlarged. There is definitely there is a two or double or three times splenomegaly. There is a mucopurulent discharge. Trachea will be having a frothy appearance, and always the lungs is a target organ, which you will find that, as I say, there is a consolidation and the edema of the lungs. Now, what are the say different specimens you will collect while the postmortem is the blood. That is for the diagnostic purpose. You will in anticoagulated while you will collect the blood, and that will be for virus. You use for virus isolation or PCR and hematology. And usually the preferred sample which you should send is the swab of the conjunctiva or swab of the nasal and the swab of the buccal cavity. Then the organs, the tissues which we will send is the lymph nodes, spleen, lungs, and intestine, and the ileocecal. Actually, particularly ileocecal junction is the more things. Now here you will find that there is a consolidation of the lungs. Here you will find these are the lymph nodes which are being enlarged. Here is the consolidation and hemorrhagic changes of the lungs. Here you will find the ileocecal wall and hemorrhages. These are the colon where you are able to see the zebra markings. Now the diagnosis, the clinical cardinal signs itself, they are very self-explanatory, and they can make the diagnosis very easy. Epidemiological features, that where there is overcrowding and how the affected animal has come in contact, and all those things, they will help you in the making the diagnosis. Now the clinical pathological feature, that there is a leukopenia, lymphopenia, increased PCV, thrombocytopenia, hypoglycemia, hyponatremia, and uremia. These are the supporting features. Of course, the isolation of the virus is a standard golden test, but all these tests, all molecular technology tests, are cumbersome and they are costly. But the clinical picture, as I have described you, is a self-explanatory, and I am sure that with these pictures and with this knowledge, I think no veterinarian will fail in diagnosing a case of a PPR in sheep and goat. Now, what are the similar diseases in which the similar symptoms are found, and what are the differential diagnosis? Rinderpest is a main disease where you can get confused, but the rinderpest has been eradicated in 2011 itself. Pasteurellosis, where the particular cardinal symptoms will be there, and there will be a bipolar organism, CCPP. There is no involvement of a oral cavity or digestive tract, or where these nodules are restricted, these over the skin, and their appearance and their pattern is definitely different. Blue tongue, coccidiosis, all these are the simple things which can we can differentiate it. Now, the other two aspects, one is the most important aspect of the management one is the therapeutic approach, and the second one is a controlled approach. Now, as far as the treatment is concerned for the management of PPR, now, as you know that because it is a viral disease, there is no any specific treatment. It's not like that. A particular antiviral drugs are not there that you can give and say you can cure the animal within a day or two. And if this would have been there, then so much mortality would have not occurred. Now, the first thing we should do is that you isolate the animal which is affected. Immediate isolation is the first stage. One must go from clinical animal. Nutritious diet you must give it. Hyperimmune serum can be given to those animals which are valuable and which are, say, very precious animals. You can go that you can have a hyperimmune serum of a cattle with the rinderpest. Rinderpest hyperimmune serum can be given, but all those things are very costly and they are almost unaffordable. But now what you can do is a fluid and electrolyte therapy. Balanced fluid and electrolyte therapy must be given so that affected sheep or affected goat should not go for a dehydration state. Any animal with any disease can survive as long as the dehydration state has not been affected for more than 50, or it is less than 15%. 10 to 15% dehydration is there, the animal is at risk of death. And therefore, a BSFR side don't allow any dehydration to cross the level of a 20% or 15%. And give immediately a fluid and therapy. The most important thing because of which the death occurs is a secondary bacterial infection. Now, the secondary bacterial infection can be combated, can be taken care of by use of a broad spectrum antibiotics. Now, adjuvant therapy, along with the broad spectrum anti, is that one must have an approach to damage the internal pathology. And therefore, the immediate reduction of a fever, immediate reduction in the inflammation, if these are the targets of a veterinarian, then the damage or the extent of a mortality will be greatly reduced. The supportive therapy with the B complex and vitamin C particularly, that will help in the building of a collagen or connective tissue and for the recovery or health. Now, the question comes that which antibiotic you should go for it. See, as a veterinarian, you have an ample of choice. As a veterinarian, say ample of choice, and you will be criticizing me that why you want this and that and this knowledge. See, when you are treating a flock of sheep and all that, the most important thing you must bear in mind that your selection should be efficacious. One thing, most important thing. And the equally important thing is that the cost of treatment should not be too much. For any cost, for any treatment aspect, or for giving a mass treatment, or for attending any outbreak and all that, the most important thing for a veterinarian, not for a human doctor, but for a veterinarian, one must go for a cost benefit analysis, cost of treatment analysis, cost benefit analysis. Say what is the benefit and what is the cost of your therapy. And therefore, a fluoroquinolones, which are bactericidal, amphoteric, say it is having a high volume distributions, it is stable in the tissue, and excellent as far as the soft tissue infections are concerned, which are active even if they are at a low concentration dependent, and once they are affected, usually say once they are administered, they are having a long post-administrative effect. So that means for a veterinarian, you can give only once in a day and all that. And this therapy usually it requires for 3 days or 4 days or 5 days, depending upon the severity of the disease. But with all these benefits and features, the enrofloxacin, say this fluoroquinolones can be preferred. Now, among the fluoroquinolones, which is more specific for elementary system and the pulmonary system, naturally the our side goes to the enrofloxacin. Now, enrofloxacin at a dose rate of 2.5 to 5 milligram per kg body weight is recommended. And say enrofloxacin to an extent, say when in Canadian and all that, say when the cephalosporin derivative and the enrofloxacin were compared for a bovine respiratory syndrome, of course, though it's a cattle, but the target organ, they have evaluated in the pulmonary systems. And in the Canada, what they have observed that the enrofloxacin is more efficacious as compared to the cephalosporin. So, of course, see, it varies from area to area, disease to disease, and all those. There are a good number of factors involved in it. One cannot say that this particular injection is going to cure, but on an average, the efficacy of this disease and the cost-wise treatment, if we consider all those things, and enrofloxacin appears to be a preferred drug to combat the pulmonary infections, bronchopneumonia, and to reduce the death rate, mortality in case of a small ruminant affections. Now, adjuvant therapy, I have told you that, see, unless you are only giving antibiotics, it will not be sufficient. You have to reduce the inflammatory processes which are going on at a different tissue levels, where there is a more number of a prostaglandin synthesis, and a prostaglandin synthesis must be stopped immediately. It must be stopped, and for that, non-steroidal anti-inflammatory drug is a very good therapy. You can take help of a non-steroidal, and the safe non-steroidal anti-inflammatory drugs you can select and you can give to an affected sheep or goat. Now, along with this, you can go for antidiarrheal preparations, intestinal sedatives. These preparations will help in reducing the diarrhea. With the reduction in the diarrhea, there will be reduction in the loss of electrolytes from the body in a sheep and goat, and naturally the animal will feel better. It will have a good relief. Now, frequent cleaning of say, what is the frequent cleaning of oral cavity lesions, discharges of the eyes, discharges of the nostrils by 2% sodium carbonate solution. Say, baking soda is available throughout the world. Baking soda, or say baking powder, NaHCO3, baking powder, baking soda, sodium bicarbonate is available. It is being used for cooking, and it is available for in bakery, and say it is exclusively used in bakeries, and is available worldwide, everywhere in every country, and is a cheapest powder. If you can make a 2% solution of a sodium bicarbonate, yes, just in a cup of water, you can just put just 2 grams of a baking soda, and with the cotton separately, you can say to soak that sodium soak that cotton in a 2% sodium bicarbonate solutions, remove that and remove the debris of a which is deposited in the oral cavity, which contains large number of viruses. You remove that debris over the tongue and throw that in in your trash bag. You throw that cotton separate. Then with a separate cotton, we clean the nostril area. Then with the third cotton, clean the ocular area, ocular discharges. So if you are frequently cleaning with the 2% soda bicarb solutions, these areas, that means over a tongue, or at the nose region, at the muzzle region, and at the ocular region, at the nasal passage and at the ocular region, and over the tongue. If you frequently remove in a day 2 or 3 times, it do not cost any more. You have to just take care of you have to just clean it 2-3 times. It will reduce the virus load significantly. If you are reducing the virus load, that means the further consequences they are being taken care of. So this is a good management you can try. As you can try, means I say I'm sure that with this you can control the outbreak in a very early stage. While treating a flock, all veterinarians should remember that you must inspect first a herd of unaffected goats. You must infect first healthy goats and then you go to the affected goats. You will first, because they are more serious, you will go to the first treat animals. You will go to the affected goats and then you are going to treat the healthy goats. That means you are carrying the virus from affected goats to a healthy goats. So such things you should not do. And when you want to do this, you must take a proper precaution. That means you have to change the clothing. You have to change your hand gloves and all that, and then you can do it. But a general principle, I have told you that, say, when you are inspecting the animals, the first you should inspect the unaffected animals, and then you must inspect the affected goods. Now, enrofloxacin preparations, Ashish Life Sciences, they have a good preparations. Ashilo 10%. Definitely, you can trust on this. Meloxicam, you can trust on this. This is a cheaper non-steroidal anti-inflammatory drugs and at equally efficacious. Now, both enrofloxacin and meloxicam say they are cheaper, efficacious, and as far as I have told you that, see, cost benefit analysis is the important criteria in an epidemiological aspect in veterinary, in any epidemiology. When you are treating any outbreak, when you are attending any outbreak, or when you are treating any disease, in epidemiology models is a cost benefit analysis. For example, for a goat, if you do not deworm, what is going to happen? What is the cost of a tablet, which say fenbendazole tablet? You are supposed to give it 2 times or 3 times in a year, depending upon the prevalence of a endoparasites. What is the cost of a that fenbendazole tablet, and what is the benefit? If the cost of a fenbendazole tablet is exceeding the benefit, then the epidemiological model says that, see, you have to see, you can change, you can have another option of a antiparasitic drugs and anthelmintic drugs. You can change the anthelmintic drugs so that the cost benefit analysis should be improved. So in a similar way, and as far as the small animal practice is concerned, where large number of heads are present in one flock, because say if in any flock, it is not like that you are having a 2 sheep or you are having a 3 sheep, or you are having a 1 goat, or you are having, say, a person can have a 1 cow, a person can have a 1 buffalo, or a person can have 1 cattle. But as far as the sheep industry is concerned, or as far as the goat industry is concerned, usually they are present in large numbers. And for a treatment of a large heads, these 2 drugs, I think they will be of a beneficial in giving the relief from any infectious disease. Now, the next part, what are the control measures? What are the preventive measures one must know and one must adopt for a PPR disease? The only effective way, actually scientifically, the effective way for control of PPR is a vaccination, mass vaccination. Now, all these things, scientific way, scientific approach, say scientific rules and all that, they are there. And in the daily practice, there are various practical difficulties which cannot be adopted. That can be, I can understand, but see, one must know it, and because of this only we are not able to treat properly. But anyhow, see, the way is that one must go for a vaccination. And the other important things one must know that the isolation and quarantine measures. If you are suspecting, you isolate it. When you are want to quarantine it, and use of effective medicines. Now we are the all scientific community are working, but whatever the available vaccine, vaccine is available, that you must be given. You must be able to maintain. You should may be able to maintain the cold chain, and then only you should go for a vaccination. All those things. Now, say sheep and goat of the affected flood must be under quarantine on all sheep which have suffered, or all goats which are suffered with PPR, they must be under quarantine. They must be under a constant observation for a period of 21 days. Now, I have told you that the reason is that their excretions, their secretions, they are positive for a PPRV virus, and their secretions remain positive for a PPR virus for a period of another 21 days, and therefore one must take care of it. Now, animal movement should be strictly controlled, and the vaccine is live attenuated vaccine, which is widely present in all all continents, and that can be used. All lambs and all kids, they must be vaccinated at the age of 3 months or at the age of 4 months. And mass vaccination program must be carried out for 1 year and a second year. Okay. Now, focused vaccination, that is ring vaccination is there, mass vaccination is there. These campaigns must be taken care of, and you must see that the herd immunity is being achieved. Now, endemic, you must have a watch whether the nearby countries they are present or not. Now, sanitary measures is that cleaning and disinfection of a area, contamination. Dead animals and carcass should be deeply buried. Monitor, say, animals closely and frequently. Say those animals which are suffering with any disease, you must have a close surveillance on this. Now, the disinfections, what we can use is that you can use any alkaline solution or any detergent solutions, sodium carbonate or sodium hydroxide or sodium hypochlorite. These are the good detergents which can use to disinfect the entire premises. Okay. Now, when there are outbreaks, the precautions which you must go for is the strict quarantine, mass immunization, decontamination of the premises, and proper disposal of the carcass, and restriction on importation of a sheep and goat from the affected areas. Now, when you are say purchasing a sheep and goat, you must see that they are healthy, alert, and they do not have oral lesions or any secretions and all that. And after purchasing, just isolate them for 15 days and then you. Now, see, these are the do's and don'ts that you are commonly are well versed, that when you suspect that the sheep is may be having a PPR, then immediately contact the veterinarians and then wash the shed with the disinfectant. And these are the don'ts that what I have just now described, that don't send the animals for grazing, and don't open the carcass. It must be buried, because otherwise if you are opening the carcass for skin and meat purpose, say that will contaminate the area, and we will not be able to control the PPR spread. And all this, with all these precautions, if you take, definitely, if we manage, if you manage this, all those things, definitely you will be able to check the PPR infection and spread of infection. So thank you very much. Now, this is the typical picture of a PPR affected goat. This goat is telling thank you to ALS and of course all veterinarians. Thank you very much.
Thank you so much, sir, for this giving insight of PPR in sheep and goat. Obviously, it was very important to know that now recently it has entered to Europe also. And equally large animals, the large ruminants, they are equally, prone for this disease, but obviously they do not show any symptomatic, symptoms. Means they are all subclinical infections.
Yeah, they are dead end hosts.
Right. So, and obviously, sir, it was very helpful that our two products, that is meloxicam ash injection as well as our enrofloxacin, Ashiendro as well as meloxicam. So both are, highly recommended, especially in case of the PPR because of the wide distribution and excellent soft tissue penetration. So those were very, really inside edge for our products to know about that. It is again a helpful for treating this deadly disease in sheep and goat. So thank you, sir. Thank you so much. And here are few quick questions, sir. We will take few questions. Uh, like, sir, just a sec. Here is one question. Just a sec. Like, there is one question from Mr. Fekadu that, sorry, Mr. Berenje. So, does the PPR eradication strategy, which is carried out based on the disease outbreak, can truly eradicate the disease?
Yes.
Especially, yeah, he's from Ethiopia, sir.
Pardon? Sorry.
He's from Ethiopia. He's from Ethiopia.
No, see, eradication, we want to eradicate this disease by 2030. The strategy which we are, the strategy which is planned is on the similar lines of a rinderpest, and it is now whatever the things we have, whatever the items, things I have explained in my lecture. See, if we help them, if we follow all these rules, definitely we will be able to eradicate by 2030. Now, the only one difficulty which is there in his mind is that what type of vaccines they are being used. Now, the present vaccine, now what is happening is that, see, what particular vaccine they are using. Now, for example, see, I'm using a homologous Sangri strain. Now, in Ethiopia, which particular strain is there and which particular lineage is there, and the vaccine which is there, which it belongs to that particular lineage. Say whether while giving a vaccination, all the cold chain is being maintained. Now, if say I have to vaccinate, say 2,000 sheep. Now the vaccine while I have there today, say vaccine while I opened it, to some vaccination I have done it, some vaccination I have not done it. The vial remains as it is. It is not a thermostable. The vaccine goes it. You do the vaccination only for physical purpose, but its purpose is not being solved. So there are certain criteria while doing a vaccination, what particular precaution are to be observed. If the veterinarian is observing that precautions, if the veterinarian is observing the recommendation of that particular product, of that particular vaccine, then the vaccination will be a successful. And if the vaccination is successful, and if the vaccination I have described, that vaccine is carried out, vaccination is mass vaccination cycle is carried out consecutively minimum 2 years, and then some revaccination, some percentage of revaccination on a similar way of a pulse polio vaccination. Now, in pulse polio vaccination for the polio, they are doing vaccination, and this vaccination program is designated as a pulse. What is the meaning of a pulse? At a regular interval, they are repeating it. So in a regular interval, if you go for vaccination program, mass vaccination program, definitely we will be able to cover 80% of the, even if we are able to cover the 80% of populations, we will be able to eradicate in a stipulated period.
So that does mean, sir, obviously as mass immunization will help, the herd immunity will be there.
Yes, yes.
The most important aspect, sir, if you allow me to speak,
Yeah.
will be that how quickly we are identifying the disease and how quickly we are isolating that animal and treating it.
Yeah, that is
That
there.
also will help out for
I have told
emergency.
you now, in the initial stage is most important thing where the isolation is important. You have to identify based on the symptoms. Symptoms are very cardinal.
True, true, sir.
Because
And
these are the, see, mucopollutant discharge, whitish deposits, dyspnea, whitish deposit and fetid odor. Fetid odor, whitish deposits, brown-like deposits over the tongue. These are the cardinal signs. Every
true, true.
sheep, every goat which suffers with the PPR is having a similar symptoms.
And sir, as you said very correctly, that selection of vaccination is very important. So
Yes,
selection of antibiotic also important as far as to check the secondary.
definitely.
Okay.
Selection of antibiotic will reduce the mortality rate. When you are reducing the mortality rate, you are reducing the
Yeah,
spread of infection.
true,
When you
true,
are
sir.
reducing spread of infection, that means you are reducing the prevalence of the disease.
Okay. So the next question is from Dr. Chukubudi. So he's asking that the question is the predisposing factor, certainly what we discussed is stress, but whether we can see that outbreak in non-stressed animals also,
Outbreak in
non-stressed animals, because one
non-stress
of the,
animal. See, no, it is not like that the non-stress animals do not say what nearby, if animal is a positive, if the non-stress animal has come in contact with the affected animal and the virus and the virulence and the virus which is being present is having a more virulence, is having a more virulence nature, then in that case your healthy animal do suffer. Say for example, I am a very healthy, okay, I say I'm a very healthy and I'm taking all precautions, but I have approached a say I have come in contact with a human being which is suffering with a which is at a high peak of his COVID infection. So definitely I will also get a COVID. I'm also going to get a COVID. So I'm unstressed, but I am going to get a COVID. So in a similar way, even if your flock is under healthy and it is not under stress, but if it has come in contact with an uh, any other animal of who is in incubation period of a virus whose virulence is very high. Say, I have told you the triad therapy. It depends upon the occurrence of a disease depends upon the first is the virulence of a virus. If it is to what a virulence nature. If it is more virulent, say unstressed animal are definitely likely to get an infection.
and the most important, sir, is like that the stress is not measurable. So we cannot say the animal is stressed and the
No,
animal
no,
is not
say
stressed.
stress will be there. It is
Hmm.
important.
Because in environment also the stress is
No
there.
human
Environment
being
is
or
there.
no living creature, no human being on this earth is without stress. No animal on this earth is without stress.
Right, sir.
So
So
that
one
is
more
a
question
different
is that
thing. Uh,
I guess this question is from the laboratory end. So because I guess the question is that the virus doesn't grow well in laboratory. So is there any reason that what any probable reason that the virus doesn't grow well in the laboratory?
it is there. Very good question. And a
Yeah,
person,
Doctor. I guess he is Doctor Yobson.
see, I can understand his difficulty because I know it. See, those persons who are doing a virology culture and all that, this is a common questions that they try in many way, but the virus doesn't get on a doesn't grow on a
Media
no cell culture.
culture.
Either they use this kidney, lamb kidney cell culture, or which cell culture is there. And some they get contaminated and they don't know. So even at an international level laboratories, this is being this is a common problem which is being suffered. Say
Okay.
it is not like that. Say, she can refer an international laboratory. I'm telling you that I know. See, I have experienced it. I know that even my own friends, they are working in at international laboratories, and they also tell that, see, they are also doing in virus work on a, they want to grow on a mice cell culture, but they are unable, and it requires some few months to get to standardize all those procedures. It is not a very easy fact.
Okay. So I guess there is one incident which one Dr. Fekadu has shared, that there was cases that the death of cattle as well as buffalo were found.
Yeah.
So means obviously, see, as this virus, as you were we were discussing, that this virus majorly affects on the three system: immunity, alimentary system, as well as the respiratory. So
Yeah.
obviously, so one and other ends, it may cause the death. I guess this will be the probable answer for this, sir.
No, it may not be, see, though it may not be a PPR, it may be some hemorrhagic septicemia or some other infections
Okay.
of immediate death. If the immediate death has occurred in the cattle with the respiratory infection, it is likely that it may be HS, hemorrhagic septicemia case, pasteurellosis, pneumonic pasteurellosis, or hemorrhagic pasteurellosis. Pneumonic pasteurellosis is exhibited by a very severe inspiratory dyspnea. While inspirating the air, the animal is having is very dyspnea, and that is called as a inspiratory dyspnea. And in the sheeping fever, you find that there is a roaring sound of a breath. So either of these can be a cause of that.
And
death.
might be, sir, the CBPP also might be the reason.
Yeah, it's
That
called,
might be the reason.
unless we know the clinical picture, unless we
It's not
have
clear.
clinical observations from a distance, we cannot make a diagnosis.
True, sir. One more question is there, sir. Okay. So certainly, Dr. Richard, your query is like that: does the ships spread the virus across small ruminants? So certainly they do spread, as the point might be clear to you. So how long, sir, they spread this disease if the animal is affected? So how long it takes to spread that disease? That is a question from.
I'm unable to. What is this? Sorry, question.
So the question is, how long does a infected sheep spread the virus?
Spread the virus. I have told you now, up to 21 days at a risk. It can be a period for 2 months extending, but usually see, once it spread in the first week, high number, and up to 21 days or up to 28 days, usually 1 month. 1 month period is in 1 month, on an average, 1 month period can be considered a period for spread of infection.
Okay. And sir, there is one more question from Dr. Belete, that does camel is a species which get affected by this?
Yeah. Yes.
Okay.
Pneumonia, all those features are there. In Sudan, there was outbreak. Of course, after 2018, there are less references.
Okay. So can this
Tanzania, these are the two states from where the references are there, but not after 2018. Pneumonic symptoms were more.
Okay, sir.
And there is liver involvement, more liver involvement.
Okay. So these kids below 4 weeks of age and they got vaccinated. Can a young goat below 4 weeks of age get vaccine? Can we vaccinate them?
See, why this recommendation is there? The recommendation is because, see, most of the times your dam is vaccinated, and the maternal immunity remains up to the 3 months or 4 months, up to the 3 months, minimum period of 3 months. And when the maternal antibodies are present up to 3 months, and before 3 months, if you vaccinate, then what you are doing is you are neutralizing the antibody, maternal antibody, and therefore to an immunized or exposed mother, if you are vaccinating a kid or lamb to a immunized or exposed dam, then you must vaccinate the lamb and kid after 3 months or at the age of 3 months, 3 to 4 months. Or if not, then you can go for early vaccination in
Okay.
an exotic areas. In exotic
Okay.
areas, you can go for early vaccination.
Okay.
If the dam is not vaccinated or if the dam is not exposed.
Okay. So how long we can vaccinate the animal annually?
Annually.
Yeah, once in a year or twice in a year.
Once in a year is sufficient.
Once in a year is sufficient.
Once in a year is sufficient, and they have observed that the immunity of after vaccination, it remains lifelong or it remains more than 6 years out there.
Okay.
In exotic areas, you can change the pattern. You see the in exotic areas where there are large number of repeated outbreaks, then you can go for vaccination, but otherwise there is no need.
Okay, sir.
Suppose there are some areas where there are repeated outbreaks are occurring in neighboring. Say
Okay.
my flock is safe, but in my neighboring neighborhood flock, repeated outbreaks are occurring. Then you can go for vaccination. Then you can think of vaccination, revaccination. But otherwise, it is not required.
Okay. So as we were discussing about the lineages, so is there any cross protection amongst these lineages?
No, it's not like that. It is not. Only thing is that what is observed is that instead of cross protection, in the sense that say those lineages which were there in particular area, suppose for example in the Tanzania the lineage 4, which is more prominent in the Indian subcontinent, was not there, but now the lineage 4 is there in the Southern Africa. So it has entered. Cross reactions are there. Instead of cross protection, you can say cross reactions.
Okay.
Cross reaction.
Dr. Irdachu, certainly as sir has explained that ALS 2 products, meloxicam and Ashendo injection, both injections you can very well use when we don't have vaccines over there. So this both will take care of the
along with these two products, the other normal normal principles of management which I have explained you, those also must be followed. It is not like that only these two products will be there. What will happen if you use these only two products and if you are neglecting the managemental aspect, and if the death occurs, then the blame will come to these two products or any other medicine.
True, sir. Very true, sir.
This is not like that.
Okay. And sir, there is one nice comment from I guess Dr. Musa, that he doesn't have a question, but he just wants to compliment that the presentation is very brilliant.
Okay.
So thank you so much, Dr. Musa, for your comment. And certainly, this is a seasonal disease.
Yes, pardon. Sorry.
No, this one question was that this disease is seasonal or what? Yes, there are.
No, it's no. See, but I have told you the pattern of disease differs from country to country. See, yes. In certain areas, say for example in India, it is there more in the September months or in the summer months, and in particular area it will be there in that. But of course, seasonal influence will be there where the goat is there under stress, but it can occur at any time. It's not seasonal variation will be there, but depending upon the stressful conditions, it can occur.
True, sir.
Yeah.
Okay, sir. And then let's have some quick 2-3 questions.
Yeah, definitely.
Sir, if the animal is recovered from the PPR, so can we revaccinate the animal again? And after how long?
Yeah, see, once it is recovered, just wait for 3 weeks, 3 to 4 weeks, you can vaccinate it.
Okay.
Actually, there is no need because it is exposed and it has developed antibody. But if you are in NZD area, you are highly this, you can go for it. But actually, once it is exposed, actually there is no much need as per me.
Okay, as per your experience, it's not needed as it
There
has
is
natural antibodies.
yeah.
Okay. Okay, sir. Thank you so much, everybody. That it was really nice to have you, and as not only merely sitting but or listening to sir, but with your active participation and questioning, it is really an encouraging comments also. So surely, Ashish Life Science will try to have this on regular basis. This kind of webinars for your knowledge building for everyone, evenly for me also. Some refreshing knowledge was there, and literally, sir, it was looking like that I'm still sitting in the your lecture and I was in the class and I am hearing your lecture.
I'm thankful to Ashish Life Sciences. I'm thankful to my all audience for patientful hearing.
No, and it was very nice because everybody was interacting and they were just asking some questions related to all they have their doubts, and evenly the question like the person was very interested that how I mean the virus is not growing in the culture,
Yes.
how we can interact, and all these questions were there. So it was
Okay,
really
now,
nice to discuss with all the technical people over here.
no,
And
they can contact me they can send me
yes, sir,
mail. See,
we have our local representatives over there. We have our people.
yes.
So through them,
They
surely we
will
will
be
be in
helpful.
touch. Yeah, we will be, because to address all the queries will be very difficult. So then we will take it again further. Then how will be the next topic and everything else. So I would like to just screen stop. Okay, so everyone, we will just have as you have spent your time and active participation. So quickly, we will have one round of kind of a lucky wheel of fortune. So let's see. Are we ready for it? Yeah, and this is a quick. So just let's see. So these are the participants we were having. So let's hope that we have three. We will be announcing three winners, and let's hope that the best one who interacted very well should win, and everybody has participated very well. So thank you so much. So let's spin this wheel. This is online. There is nothing in this one. This is totally online process. Okay. So one on the count of three, please. One, two, three. So let's spin the wheel. Wow. Can you note down, please? So Mr. Nachinel David is selected. So he is our first winner.
Congratulations.
Congratulations, doctor. Ek minute, ek minute. Okay. Okay. Now, can we have our second winner, please? So let's have our second win. Let's hope. Congratulations, congratulations, doctor. Dr. Abdisa.
I think her MSc thesis is on PPR.
So is it she? Because I'm so sorry that. Can you just chat, Dr. Adisa?
Whether her MSc thesis is on PPR?
Sir, actually, this is a webinar platform, so she cannot speak on it.
Okay.
Yeah.
I think so.
Okay. But always she can write in chat. No problem. So let's have our third winner. And the third winner is Dr. Roba Hassan. Thank you so much for your time. and
Congrats.
congratulations. So thank you so much. So these are our three winners, and our colleagues from the respective country will surely come and visit all of you, but especially the winners also, to give them the goodies. Smita, we done? So let's have one. They take class like that. So okay, so these are the this is the result. Dr. David, Dr. Adisa Lema, and Dr. Roba Hassan. So surely our colleagues from the respective country will come and visit you, and we will be in touch all of with you. And everybody was asking for the presentation, so surely I will discuss with sir, and yeah, we will share across to our respective managers so they can share with all of you. So again, I wish you thank you so much. And after this webinar, we will have a quick, you will get your feedback is very important for us for our internal improvement. And I request you for your patronage that you will continue to support ALS products, and especially the new, the product like melosic acid injection as well as Ashwin injection, which are very unique products. As sir also was discussing about this product. So thank